Are we live? All righty. Hello, hello, and good afternoon, everyone. I am Mary Weinberg, your chair for the Health and Safety Committee meeting. We are excited. There are 2 more days before the start of school. School starts on Thursday. I know that I'm not the only one that is excited up here, but we have some business to attend to, so we are going to start our meeting. I am going to take a quick roll call. I know that I have to my right here Board Member Moffitt.
Yes,
And then to my left, I have Board Member Jones.
I am here.
And of course, I am here as well. If you have turned in virtually, I'll get there. If you have turned in virtually, the documents that you will be reviewing, they are located on Board Docs through the CPS website. And I just want to make a quick reminder that we have, if any members of the public who wish to speak, you may do so by clicking the chat button. The chat feature will be open for a request of 3 minutes, and please submit your name, your affiliation to the district, your school community, your topic, and your contact information. And if you want a direct response to any questions you might have. We have a small agenda today. We also have our lovely superintendent. Superintendent Wright is here with us. And then we also have our liaison, our legislative liaison, who will be here presenting. So I think I'm going to start off first with our first agenda item, which will be our government liaison report. And we have Mr. Kearney. So Mr. Kearney, the floor is all yours. Thank you.
I always do
we
that
have to get
wrong,
that mic
don't
turned on. Thank you.
You think after all this time I'd get it right. Okay. Good afternoon, Madam Chair, members of the Health and Safety Committee, and Madam Superintendent. My name is Eric Kearney. We have a legislative report which is different than the other reports that you have received. And you say, why, Kearney, is it different? Well, the reason is that it's divided differently. I put together all of the pending bills in the House and Senate primary and secondary education committees. And the reason for that is they're on hiatus, and they won't be back until probably after the election unless something crazy happens. So I wanted you to get a sense of all of the bills that are pending in front of the committees. And I just did little blurbs about it. Nothing is hot or nothing is really to be brought to the top of the list because things will all change after the election. And it's what's called crazy season because it's lame duck.
Do you have anything for us to view, or will this just be verbal for us?
No, it's on. I submitted it.
It's on Board Docs. Thank you. Making sure.
Yeah.
Typically, we have another copy here, but it'll be good to go.
Yeah, I did not bring a hard copy today.
Nope. We got it. Thank you.
And then the second part of the report includes all of the bills that have been filed since August 1st. And that just gives you a sense of what legislators are thinking about doing. You'll notice that most of them are honorary bills, resolutions. In fact, they're all resolutions except for one bill. So they're all resolutions, so they're not necessarily impactful to the work that you do. And then the third section deals with it's called Week in Review, but it's really highlights about what is relevant. So if you look at page 16, that's where I am. It talks a little bit about the budget going forward. It talks about kids and families and COVID with relationship to COVID. There's news about the coronavirus and monkeypox. And then there's a section entitled Education. It deals with the Ohio School Board Association announcing Sally Green as a Northeast Ohio School Board member. Also talks about STEM Learning Network, the State Committee on Computer Science, and then ODE and the STEM Committee, information about that, and then the Columbus Education Association and their notice of intent to strike. So that gives you an overview of some of the hot topics in education that are going on across the state so that you can be informed about that if somebody asks you. And then there's also some information about the State Board of Education. I'm at the bottom of page 19 if you're following along. And that talks about the 5 candidates for the State Board of Education, which sets curriculum for the state. And then there are just a few other items that might be of interest to you. But those items are directly related to the work of Cincinnati Public Schools and your committee.
Thank you. Are there any questions for Mr. Kearney regarding any of the hot topics that will be starting back out at the House? Any questions? Mr. Kearney, I think this is a first. Thank you so much for the presentation and providing us with the documents on a recap. We do not have any questions, so I appreciate your.
Okay, thank you, Madam Chair. I'll be back.
We'll see you later. Thank you so much.
Thank you.
All righty. All right, we are going to move along, and up next we have a COVID-19 and monkeypox update. We will have our superintendent. She will present, or at least let us know who will be presenting. Your mic, yeah.
Okay, thank you so much. With our last week, Thursday, I believe it was, that we did get 2 of our health partners after having conversation with our chair for the Health and Safety Committee. We did get 2 of our health partners from the Cincinnati Health Department that were able to come today and present to us. One was going to come in person and the other was going to come virtually, but today they did have other scenarios that they had to work through. So both of them are here virtually from the Cincinnati Health Department. And thank you, Ms. Davis, for making sure that they received those links. I've already seen their pictures up on the screen. I have Drs. Grant Mussman and Drs. Grant Mussman and Amin from the Cincinnati Health Department, and they're going to provide both the COVID and the monkeypox update.
Thank you.
Thank you so much for inviting us to speak. Can everyone hear me?
We can hear you a little bit.
Okay. Well, I'll just have to speak up, I guess.
That's much better. It's much better now.
Oh, perfect. So my name is Grant Mussman. I am a pediatrician and the interim medical director for the Cincinnati Health Department, and I'm here with Dr. Maurice Amin, who is the associate commissioner for the Cincinnati Health Department, and we're going to talk about monkeypox and COVID. If you don't mind going to the next slide. So we're just going to give some updates and about both of these illnesses. So monkeypox, I'm sure everyone knows by now, is I guess I would call it uncommon now, disease caused by infection with the monkeypox virus. And monkeypox virus is part of the same family of viruses as variola, which causes smallpox. And the symptoms are actually similar, fever and the rash, which can be all over the body and can be and will open up or crusting over. But the symptoms are milder, and monkeypox is very rarely fatal. In fact, we have not had a fatality in the United States, and there have been 11,000 plus cases. We've only had 89 in Ohio, which are mostly in Columbus and the Cleveland area. And when I wrote this, I thought we had 6, but we counted one. I was counting one twice, so we only have 5 cases in the city of Cincinnati. So a couple important points that are relevant to the schools. One is transmission during brief interactions hasn't been reported. Direct skin-to-skin contact, including close intimate contact or sexual contact, has been identified as the predominant type of exposure for persons who go on to develop monkeypox. And most people with monkeypox, the vast majority, have been adults and have not required hospitalization. What hospitalization has been required is mostly for pain control. And the few children with monkeypox appear, turn off, there we go. Sorry about that. The few people with monkeypox, or the few children who developed monkeypox appear to be household contact. Deaths have occurred worldwide, but they're rare. So a couple things that we still don't know very well. And one is to what extent children are at risk of severe disease. In some previous outbreaks, children under 8 were at some higher risk. And how often monkeypox virus may be spread from respiratory secretions. The CDC has advised healthcare workers to use respiratory precautions when dealing with monkeypox patients. It's not clear how much that kind of spread actually happens. And it's not really clear how much monkeypox may be present in bodily fluids. All that being said, just to point back at a point on the last slide, is that transitory contact really hasn't been observed. And just to reiterate again, also for children, they're mostly household contacts, or they, in the United States so far, from what information is available, those cases are household contacts. And then there's no official school guidance from the CDC or ODH or other public health body for monkeypox. Generally, the advice is that children with fever and rash should be treated according to the way you would treat it currently. And the same disinfectants which are used for COVID should be effective against monkeypox. And any adults should just maintain awareness of their health status and seek care if they suspect they have monkeypox. With that, I'll turn it over to Dr. Amin to talk about COVID.
Good afternoon, everyone. Can you hear me?
Yes, good afternoon.
Great. All right, thank you for having us. So I just wanted to give a little bit of an update of where we are with COVID and what the new guidelines recommend. So CDC has developed the COVID-19 community levels, which incorporates the cases within a community per 100,000 of the population, and then admissions per 100,000. So those are hospital admissions, and then the percent of beds within the hospitals that have COVID patients in them. And so once those 3 levels reach a certain threshold, that may change where the community level is. And so currently for Hamilton County, we are in what we call high community level, and that is represented by orange. So that means that we are high for the cases per 100,000 for Hamilton County. We're at 228 as of end of last week. For admissions per 100,000, we're at 11.5, and for the percent of beds occupied, it's about 6%. So with each change in the community level, there are recommendations that come with it. So it's just, starting from the low level, it's making sure that people are up to date on their vaccines. So that includes those that have received boosters and those that are eligible for a 4th booster. We are now able to vaccinate those 6 months and up. If staying up to vaccine for, everyone of all ages. And then once you get to high community level, where we are right now, the recommendation is to mask in public when indoors. And then for those that are at risk of developing severe disease or potentially immunocompromised, taking precaution if you're around those people, or for those individuals to also mask and try to refrain from being in crowded places indoors. Next slide, please. One of the other measures that we've always looked at is the positivity rate. So that's the percentage of those who are COVID positive over the percentage of those that are getting tested. We know that this number has been under reliable just because of home tests and everybody not reporting when they're testing or even when they're positive. But from the data that we have that's coming from the providers, we're at 16.4% positivity rate. So as you can see, the blue line is representing that, and we're not where we are with COVID, but it has continued to increase in the past month. Next slide, please. So we just talk about what safety measures and precautions. The CDC updated their guidance as of last Thursday, but there are still preventive measures that are really important to take place because we know COVID is still in the community. While the hospitalizations have, it's great that they have decreased, there's still risk for developing severe disease in some settings. And important ways to mitigate that risk is staying up to date on vaccines, as I just mentioned, making sure that people, students, faculty, stay home when they're sick, or if they're getting tested, if they're not taking a home test and it's by chance a test that takes 24 hours, that they stay home until they get that result, because if they're symptomatic, it could end up being COVID and you don't want to risk exposing other people. Having ventilated spaces, reminding the students, washing their hands routinely, in the restrooms, and just making sure that the contact between the face and hands is limited. Cleaning surfaces, we did just talk about the COVID community levels, being aware of where we are as a county and adjusting to those recommendations. Masking. When community levels are high, or in events where you've potentially been exposed, or in your last phase of your isolation. Testing, whenever anyone is not feeling well, to just try to seek a test as if at all possible, just to rule out COVID. The management of cases and exposures is where the new guidance has come out. And so what CDC is now recommending is that we have these great tools to try to prevent disease, both treatment and testing, rapid testing. And so the isolation is still required. So isolation is when somebody is COVID positive, is confirmed to be COVID positive, and they are potentially most infectious in their first 5 days. So they should isolate in their home and try to isolate from others in their home for the first 5 days. After the first 5 days, if they are unable to continue wearing a well-fitted mask, or if are unable to test, or have a severe disease, then they should continue to isolate for that second 5 days for a total of 10 days. However, if somebody is able to have symptom improvement, is fever-free for 24 hours without taking any fever-reducing medication after the 5 days, and is able to test negative twice within a 48-hour period, they can be released from isolation. Alternatively, an individual after the first 5 days could be out in the community as long as they're wearing a well-fitted mask for the next 5 days. Another part of the guidance change is the quarantine. So for individuals who were unvaccinated previously, they were required to quarantine at home for the first 5 days, and there was testing options. So right now the guidance is that you can that quarantine is still for 10 days, but it doesn't have to be in the home. So that somebody just should be monitoring their symptoms and wearing a mask for a 10-day period. And as long as they are symptom-free, they can test at 5 days. And then just responding to outbreaks, being aware of the number of cases in a certain setting and being able to uh, act upon whether that's screening testing or any kind of diagnostic testing. All I have.
Thank you so much to both of the doctors for providing some more information regarding COVID and also with the monkeypox. I do have a question for Dr. Musman. You had mentioned that currently the CDC, they do not have any recommendations. Do you know or have you heard if the numbers continue to rise? Do you think that there will be any recommendations coming from the CDC regarding the monkeypox?
I have not heard anything from the CDC or ODH. And to be clear, they do have recommendations for uh, the community at large and for providers and for risk groups, just not for schools. I have not heard anything from ODH or the CDC indicating that they intend to do so. I think it would be if they're, I would speculate, and by that I mean I'm guessing, that if there began to be a problem with large numbers of cases in schools, that they would probably release some school guidance.
Okay, thank you so much. I'm going to look to my colleagues. Any questions? Board Member Jones.
Thank you for the update. My comment is not on either monkeypox or COVID, but rather hearing now about the rise in polio in the water in New York, and then I just heard today that I don't know who they are looking at California maybe as the next place. Do you have any comment or forethought on that and how that may impact?
Yeah, so I will say it really speaks to the importance of what we do in the school nurse program. And it really, I think, is going to be great for us to get back to ensuring a lot of the things that a lot of the public health measures in children that we've worked so hard on in the past. Not that we haven't looked at immunizations in the past, but it'll be good to be able to focus on things like that.
Okay, because the reality of it is, I remember I'm older, not old, but older, but I do remember getting the polio vaccine as I'm a boomer, and most haven't had a vaccine, and so I would imagine I don't even know if my vaccine is still good, and I think hopefully there'll be some guidance or something coming out about. Vaccinations or, the necessity around vaccinations or what have you for that.
Yeah, I think the advice right now is more geared towards the unvaccinated to maintain herd immunity.
Yes. Gotcha. Thank you.
Board Member Moffett, any questions?
I don't have any questions, but I want to say thank you so much for taking the time to educate us on, or really just update us on what's going on within the medical community and how we can keep our kids and our staff safe. So thank you so much. And I'm sure we're going to be in touch and connected. So I look forward to any updates that you all have and keeping us connected. Thank you.
Thank you, and always happy to be part of this partnership.
Thank you. All right, we're going to move on to our next agenda item, and we have a update on Governor DeWine's K through 12 Safety Program, House Bill 687, and I will let Superintendent Wright take the floor.
Great. So we were asked to present just a brief update on the Ohio School Safety Grant, and this was very timely as we had our safety town hall meeting on August the 3rd. And this came out shortly thereafter. So we wanted to share just some background information as we have it. We're still in the process of waiting for the funds to be released, but we do know that's part of the process. So to start with, I'll share, as we're waiting for the presentation to come up, to start with, I will share that this was a part of the 2021-2022 grant program. So our district had actually applied for the grant previously, And the first time we were not one of the ones that were recognized or honored for the grant. The second time the district applied again, and we have actually received one of the awards, so that's great. The funding source, was the American Rescue Plan Act, and the appropriation overall was $53 million. The maximum award for any one school was $50,000, and the total number of schools was 11,083 schools. 1,183 schools, I apologize. The award date is actually, while it's been announced, the award date is actually fall of 2022, so we don't know the actual date yet that the funds will actually be released, but they have been awarded to us. So the initial program that was done for May of 2021, which is the one that we applied for, the maximum awards were a bit different, and the focus at that point was for suburban, rural, and wealthier school districts. The future program is scheduled to be announced in 2022, which is another $47 million appropriation. So we're hopeful that as that other program comes about, it's still unclear whether or not we will be able to apply again because we received one of the most recent awards, and our award was for 20 of our schools. The application process, if we'll go to the next slide, I think I'm moving faster than you, I apologize. One more slide. Okay, great. The application process was administered by the Ohio Facilities Construction Commission and the Ohio School Safety Center. The applications were required for individual schools, and that is relevant because we can only use these funds on the 20 schools that the proposals were submitted for. So we have 20 schools that we submitted proposals for Cincinnati Public Schools. The process was a collaboration of multiple departments, so we do want to thank those departments for working together on the collaboration. It was data-driven, so the district used a combination of district reports, specifically really around the type of incidences that were happening in schools as thinking about the upgrades. Additional considerations was the condition of current equipment, as well as the size of the campus, student population, and if there were known areas that were considered quote-unquote blind spots at the school, how we could have more eyes on those spaces. So for our safety grant, the 20 schools that were awarded are on the screen: Aiken, Bond Hill, Carson, Hughes, Leap, Euler, Parker Woods, Pleasant Hill, Reese Price, Roberts, Rockdale, Roll Hill, Rothenburg, SCPA, Schroeder, Taft, Walnut Hills, West High, Dater, Withrow, and Woodward. So those were the schools that were awarded. The individual award amounts, the maximum was $50,000. So that means that some of our schools actually got up to the max and some did not. It did depend on what was requested for them. The total award for us was almost $1 million, $993,320 was the award for our district. And I do think one of the most important as well is what was requested as a part of the grant. So as a part of the grant was used to support, was the request for the grant as a part of the proposal was to support substantial equipment upgrades for all awardees, supports replacement and or increased numbers of units. So primarily, our team that wrote the grant for updated equipment, and that would be camera equipment, or what we would call surveillance equipment. That's what it was for. Digital video recorders, video cameras, standalone critical system monitors and sensors, and APC units, which are actually the backup power units for the schools. The reason that this is also exciting at this point, and I will share with all board members that are here, you know, as we have been talking about safety, one of the asks that I actually had the team to do was to give a proposal to update all of the safety equipment in terms of surveillance or camera equipment across all of our schools. So in terms of looking at those initial proposals in preparation for where we go in the next budget cycle and having some of those conversations, we do have the equipment currently in all of our schools, but there are schools, and when we think about modern technology and where it's going, there is some better equipment that we could have. So the best part about this is at least this will allow us to get equipment for those 20 schools. I have asked that they go back and now update based on that. Now we have these 20 schools. What would be the ask to get the same quality of equipment for the rest of the schools in our district? So hopefully that will be something that we will be looking at over the next year or so and how we do those upgrades.
Thank you. I know Board Member Moffitt had requested this topic. Wanted to see if you had any additional questions on that. Thank you, Superintendent Wright, for explaining a little bit more about the grant and what we are going to be receiving for the CPS schools.
I don't. I think this is very thorough. I wanted the community to be able to know that it was a press release before it was kind of sent to us, not even you. It was a press release, and so I think I want in this time of a levy, I want people to understand, hey, this is something separate. Yes, we did almost receive $1 million, but they're restricted funds, and this is what they are restricted for. And so we still are in need of our levy. So I want there to be clarity, and that's the reason why I think that the request from me was so that people can know. They already knew before we said that we got the grant, but now they know what it went for, and we still are in need. So that's all.
Thank you so much. Board Member Jones.
Yes, I heard you say, I just wanted to be clear about it. So we applied in the first cycle and didn't get awarded at that time, so we applied in the second. Did I hear you say there's going to be a follow-up?
Yes.
And we are planning to apply
As long as we can.
Okay.
So we received notice, and kind of to Dr. Moffitt's point, the press release went out. I think the next day the board may have received something, and that afternoon is when I received information. So it was all kind of moving very, very quickly. About 2 days after that, there was an initial email that went out that talked about applying for new awards. So what we don't know now, that should happen sometime in the fall. What we don't know now is whether or not we will still be able to apply because we were just awarded.
I got you.
But if we are able to apply, we do plan to apply.
Great.
Sounds great. All right, we are moving here and up again, Superintendent Wright for our safety update.
Okay, again, we do reference our safety town hall that we had on August the 3rd, and one of the updates that I will provide from August the 3rd, at that time we talked about doing our initial safety, not only doing the safety town hall, but also doing our initial safety training with all of our staff, and that happened today. So teachers' first day back was on Friday. All of our staff were back in the building today. I did the opening for all of our staff in a virtual setting where it covered everything that we talked about in the town hall, and then each school leader did their individual safety presentation for their school. So we wanted to make sure right out of the gate that we were getting the information out to start with. So we'll go through this information and then answer any questions that we have. We know that our initial focus across the district is safety first. Safety is our first priority. And it's not only are we talking about just physical safety, but it's physical, psychological, and emotional safety. And so that is something that we're reassuring our community of, our overall community, and our school community, especially that our staff is now back. We think about safety in 4 buckets, if you will. Those 4 buckets are connect, plan, train, and report. This is really coming from guidance that is by Homeland Security on how you really think about preparing and how you think collectively about starting to look at safety. So the first is connect, and this is one where we spend a lot of time in talking about, but this is the relationships that we build within the school and across the community. So that's our community relationships. Currently, of course, we have relationships with our police department, our faith-based partners, our medical professionals, our school-based leaders, teachers, students, and our parent community. We also know that we have an additional relationship with the Cincinnati Police Department that provides to us our SROs, our school resource officers. Our school resource officers are sworn officers. There has been a partnership between CPS and CPD since 1967, and that's relevant because that's been a long-standing partnership. SROs are funded by the city, and so when we think about the support that's provided to our schools, we have SROs that are servicing our schools, but they're also servicing schools across the city. That is private schools, that's parochial schools, that's charter schools, community schools. So they're servicing schools across the city, not just the schools that are in CPS. There are currently 13 SROs for the district. They're shared with all other schools in the city. So I do want to make sure that we punctuate that because we do not have SROs that are assigned only to us. They're across the city. Each CPD officer, which is important to the conversation around safety, each police officer in our city has access to our schools if there is emergency need. And so all of them, not just SROs, if there is an emergency at our school building, all of them have access to get into the schools. And last but not least, SROs are not a part of the discipline process. And we did reiterate for our teams, we've done that with principals. We really had conversation this morning with our staff about the same. Discipline is the responsibility of school leadership. It is not the responsibility of SROs. So that is not a part of their role. When it comes to overall school safety, each SRO is ALICE trained, and we're also ALICE training our staff. That's one of the required trainings that staff will do before August the 30th. And that stands for Alert, Lockdown, Inform, Counter, and Evacuate. It's what we know as active shooter training. So instead of active shooter training, it's called ALICE. Also, however, our CPD officers do receive active shooter training. One of the questions that came up earlier today in our question and answer period after we did the safety presentation that I did and the ones that were done at the school was whether or not our school security would be allowed to carry guns as our officers do. And I do call us back to the resolution that was done by our board after House Bill 99. And our board did resolve that no individuals on our campuses, none of our employees would carry guns. And so that includes our security personnel. And so if there is a change in that, I don't believe that there would be at this point, but if there is a change, it would require action by the board. SROs perform consistent threat assessment and more regular assessments if needed. They work closely with our school security, principals, school administrators, and all of that is for the purpose of maximizing safety. I think more importantly is that our SROs build relationships with students, establish trust as they're building those relationships with students, and they really are another trusted adult for students. SROs in our city they apply to go into the program. They are not appointed. They apply to go into the program, and then they're selected from there. The other thing that is also really important as we discuss SROs is they're a part of the student program throughout their entire year. So when school is out, they then spend the summer working in student-based programs where they're providing mentorship, they're doing the cadet programs, they're volunteering with students. So those officers are not put back on the street. And we know that there are some that don't necessarily agree with that they're not put back on the street, but that's the commitment at this point that CPD has made to those officers and to the district. The next area is plan, and this is where we talk about equipment. We talked a little bit about equipment here, but all of our schools have badge entry for all staff, and we have reminded all of our staff members that their badge is required at school, and that is also other individuals that are on the campus. So if they are volunteers for our schools, they receive badges as well, and they are expected to have those on and visible. That there's also a designated secure entry location where you come into the building, most specifically after the start of school. If the school day has already started and other areas are being used, we have asked our leaders to make sure that those areas are manned by individuals, because we know some of our schools are large and there are large numbers of students that are coming in. So to expect all of them to come in through one entry at one time may not necessarily be the best thing, but to monitor those areas such that once the school day starts, they then come in through one area. All of our schools also have lobby guard, and this is a visitor management system to review for predators. And so even when you come into our offices, you give your driver's license, it prints off a badge for you, but it does a quick check right then of the driver's license for predators. So that's exactly what it does. And so if individuals are on that list, then they're not approved to move in. Metal detectors are at all of our high schools, as well as handhelds are at the elementary schools. We know that there is a policy, there is a board policy around searches and how searches are done. And so we are also reviewing that information with our security personnel as they go through their additional opening of school training tomorrow. And we've reviewed that policy with them as well, because we do want to make sure that if there are searches, they're done appropriately. We don't do touch-to-touch, person-on-person searches, and we want to make sure that everyone is clear on that. Our security camera systems are in every school, even though we would like to update them over the next year or so, as well as two-way radios. And then we move into what we think about as psychological safety, social emotional learning lessons in all of our grades. Our advisor social emotional lessons are in grades 3 through 12. We do have school social workers in each one of our schools, and those social workers do provide small group and individual SEL group work as well. For our mental health support, also social workers are trained in mental health first aid and provide training to school-based staff. This year, while we've done this in the past and working with the team, we understand that that training has been optional for schools. We will ask this year that that training is required for all of our schools and done during the school day. So taking one of those times during a staff meeting to really engage in the training. The training itself is about a 6-hour training, but there are opportunities to do that training such that all of our staff members are getting that training, not just those that select to be a part of it. Security staff has also provided training in mental health first aid as well, and to review that training with them this year. There is a new suicide suicide hotline, 988, and making sure that all of our students know, individuals know. It was launched about 3 weeks ago. It was launched right before we did our safety town hall, but it is important that everyone knows that number because it is for crisis. So if we know of any individuals that are in crisis, we definitely want to have them to reach out to that number. And there is a suicide prevention protocol and risk assessment training for each school-based staff. Lastly, our mental health and therapeutic counseling is provided through a partnership with each of our schools through MindPeace. And I do believe in April or so, that wasn't April because I was already here, so I think it was around May. It was in May where MindPeace actually came and did a presentation for us as well. And our last area is train, and I've talked a lot about training, but that is an area that we did say were next steps for us, and so we're continuing to monitor those things, not only our required trainings that are required by the state of Ohio, but also the trainings that we know that are important through our Safe Schools modules. Each staff member is expected to do those every year. This year, by August the 30th, we're asking each staff to do the ALICE training, as well as the bullying training. So that will be 2 that will be done by August 30th, and there are 4 other modules that would be completed by October. So those would be the information for that. School security personnel, security assistants at all schools are trained in procedures and security equipment, and all of them as well go through ALICE, Youth Mental Health Issues, and random search procedures. And our school-based Crisis Prevention Institute trained teams as well. That's another area for us to continue to double down in because we do have individuals in each building that are trained, but we do know that the more we train in that area, the better. And lastly, the training exercises in this particular area include, as I shared earlier, emergency procedures and safety orientation, which is ALICE, our cybersecurity and bullying and child abuse. So making sure that those areas are covered. Each of our schools will also have grade level assemblies that talk about safety. So for all of our students, so they know what the expectations and the protocols are around safety, and our security staff trained as well. And last, we go to report, and the report is really important to us. And I think if there was just anything that I could say that all of us can continue to say is if we see something, say something. So regardless of what it is, if we see something, report it to the nearest adult so that the adult can follow up and do the necessary work to help to remove the risk. All schools, over the summer, we did add to each of our schools an additional phone that is a crisis alert phone. So on that phone, not only does it alert 911, it also allows outside of a school office to also do an all call on the campus. And so that was an additional add that our team was able to do this summer as we started doing some of our assessments around security and where we were. We do have systems at the school buildings that also lock our doors, the front doors, if there is a 911 alert that needs to be done. So there's a button in the school that does do that. Our emergency responders across the city respond 24 hours a day, and the quick access button phones, as I shared earlier, provide the ability to make building level announcements, which was something that we found that was a concern as we talked to principals getting prepared to go into the school year. In December of 2020, December 21st, 2020, there was a House Bill 123. It was not something that collectively we were using as an organization, but this is a bill that we found that was there and available for us, and it's called the Safer Ohio School Tip Line. Their telephone number is provided, and this is a line where anonymously individuals can call in and can make complaints about anything. They can make it anonymously. There's also the opportunity to do so on an app The one thing that I do want to call up here, however, is this does not replace CPS's bullying button. So on our website, the bullying button is still there. That is still a resource that we use. If there's an allegation or a concern, it goes in on that bullying button. But this is another option to get information out there. And there is an app that can be used as well. So a part of while I did a portion of the safety training this morning, and the principals did their safety training as well, when we did our afternoon session that we're doing for staff around PBIS, we also talked about, there was a little video that was shared as well during this time where it also talked about using the button, using the Ohio line, how you use it, how you're able to make sure that it's anonymous, and that if you see something, say something. So I think that's something that we want to continue to hit home for everyone. Our next steps, and we've already started those, so since August the 3rd, we have had some updates in these areas, but one is, of course, more frequent training. Each of our schools is preparing for that same training for our students to make sure that everyone understands the procedures and the expectations. And on the flip side of that, that we have a way to ensure that our students are addressing or dealing with the fact that we are doing these drills. You know, we can't get prepared, we have to stay prepared. And we're not looking forward to anything happening in our schools, but there is nothing that is more of a concern than there being an issue and then people don't know how to respond if there is one. So we do have to do the drills because we do want to make sure that we're prepared. And we also want to make sure that we continue to improve our delivery and consistency of mental health resources and services by our staff so that they know the work that they're doing and the follow-up for that, and that we're doing it in an integrated way as we continue to provide service to students. The last and not the least, but providing as well, one of the areas out of the town hall, which was a very positive experience, but one of the areas as well is to create a safety task force that would be made up of individuals within the district and outside of the district that would like to give us feedback around what we're doing in terms of safety recommendations that they may have, so that it does keep it at the front of everyone's mind. And last, I said last but not least before, and I say it this time for sure, we continue to improve communications with our families, between the schools, between the district office as well, so that they are aware of what's happening, so that they know if drills are occurring, those drills have occurred, and what we're doing moving forward.
Very, very good presentation. I have just a couple of comments and then I'll look to my colleagues. So first, I love that you said the improved communication, because I know that that was really big with a lot of community members in terms of the families really being updated on that safety procedure. I also like that you are starting the safety task force, but my question to that would be, how will the community know how to get involved in that task force?
Thank
and
you.
I love that you're including the students as well.
Awesome. Thank you for the question. So we know that school starts on the 18th. And so after we get school started, the goal will be to do an application process that's right on our school site that we give to individual schools, that we put out on social media, so individuals can then apply to be a part of that. I am actually going to then from there ask the board if they will select the participants that are a part of that based on the applications. And then from there, we will start the engagement process with them. So that's a little in advance of what I would have discussed at the next COW, but that would be the ask for me, that we will do the process to get it out there to get the engagement. But I would like to ask the board if they will assist us in selecting the individuals that would be a part of that task force. And then we would set up the process with them. That will be led by our chief of staff.
Okay, sounds great. In regards to also with building safety, can you just possibly give an update on the doors, updating the doors, and then the security arm for the parking?
Yes, so let me do SCPA first. So that arm was completed. So that was done for SCPA. For the doors, we had about 8 schools that needed to have their doors did not lock from the inside.
Right.
And so after coming in and assessing that and getting that information, we were able to order doors for those schools, order the locks for those schools that the doors did not lock. However, because of the supply chain concerns, we don't have them yet. They have been ordered, and as soon as they're ordered, they will be installed. So I will provide an update for you. I got my most recent, I'm getting updates on that each week. I did get the most recent update last Thursday in terms of the doors. So as soon as they're ordered, as soon as they're in, they will be installed, and our team is actually installing those.
Thank you very much. Any other questions, comments, board members? Very good.
I think it's a great idea to have the students included. That's my jam. I love the student voice. I just ask that we get, if we can, one student from each school. Let's try that. Even if they don't apply, like, let's have them apply. But then maybe make a charge to the principals to find one student from each school, and not the valedictorian. Just some student voice that can be a connection back to that school, because I think oftentimes we hear and see the most successful student, but we don't always see that student that's not the most athletic or the most successful. So with some intentionality, let's try to find some diverse students if we can in everything that we do, because we've also talked about some other engagement opportunities for like a superintendent board, and then like a student voice for the board and the superintendent's office. But I think we just need to try to be intentional. So that's my only ask. Thank you.
We have talked about that.
We mentioned
no,
it.
Just
No, her and I talked about engagement. No. Because I she did speak about wanting a superintendent and student panel. She did talk about that at the board. So she did at a meeting.
Okay.
Yeah.
I don't remember, but it's okay. I don't remember a lot of things.
It is okay, board member
That's
Jones.
all right. But anyway, Superintendent Ray, just with some intentionality, let's get a diverse group.
Thank you.
Well, thank you again. And I think we are now at other business. So I don't know if any of my board members have anything to add for other business. And if they do not, we're going to go to hearing of the public. So I'm going to ask, do we have anyone signed up to speak?
We do. We have one individual, Nancy Sullivan, who
Okay.
has been sent a request to join us. Nancy, you have to accept that invitation. So we have Nancy Sullivan.
Thank you.
Nancy Sullivan, you have to accept the request to be able to join us as a presenter. Nancy has not accepted that request, Madam Chair.
Okay. I think, can she put it in the chat? Is she able to? Do we have that ability? Or if there's an issue or problem with her connecting?
So she did already comment in the chat before she had after she had requested. So we can share that if you'd like with the board.
Okay. Was there a question or was there a comment?
She was concerned about small packs in very crowded households in Cincinnati. I know the families with 3 adults and 7 children in 2-bedroom apartments. Skin to skin contact is probable. I'm very concerned about the related issues of family income and quarantine. 2 to 6 weeks of quarantine will make it far more difficult for crowded families, not to mention the loss of family income during quarantine. Where will people go, and how can families missing a breadwinner survive financially? That was her comment.
Okay. Can you share that information? Can you share that with me? Thank you. All right. If we have no other business, I'm going to say that the meeting has been adjourned. Great job, everyone. Thank you.